Welcome to the story of ICRH Kenya, dedicated to improving Kenyan health through innovative sexual and reproductive health interventions and influential research. Join us on a journey through time to explore ICRH Kenya's impactful evolution.
The origin of ICRH goes back to 1987 when I joined the University of Nairobi in a small, at that time, research project studying the impact of HIV on mother and child. We worked in University of Nairobi, Pumani Maternity Hospital. Between 1994 and 2000, the creation of ICRH Kenya. We had already ongoing projects, but there was no structure yet. So we decided with the founding fathers, including Dr. Kishore Mandalia, Dr. Sharif, Dr. Jane Otigo, Dr. Esther Getambu, to set up ICRH Kenya as an NGO working in the large field of...
At the establishment of ICRH Kenya, our focus encompassed reproductive health, sexual and gender-based violence, and HIV/AIDS prevention, treatment and care. ICRH Kenya has offices in both Mombasa and Nairobi. In Mombasa, the organization's location has undergone a dynamic journey, transitioning from Shital Plaza to Chuda, then to Technical University, followed by a stint in Nyali before ultimately returning to its Chuda roots. Today, you'll find them conveniently located near the MM and MV Shah Academy and Ngala House.
As far as the board goes and as far as the vision of ICRH is that we are a locally developed NGO. We use local expertise. We are able to give quality work. We are able to do quality research, and being a local NGO, we are able to give quality implementation at site because we know the ground.
And I'm so happy that now it's completely Kenya-based, women-led, and a leading organization in the field of sexual and reproductive health and rights, and even far beyond.
So at the Coast General Teaching and Referral Hospital, we set up the research lab. We realized that we were starting to do clinical trials, and once we start doing clinical trials, we needed laboratory space. A need which we saw at the hospital was for gender-based violence, and the GBVRC at the Coast General Teaching and Referral Hospital is the first center of this kind in the whole of the country in a public sector setting.
We have been able to train many staffs, especially in our hospital and the other hospitals. We were able to train even the police and the community. ICRH gave us staffing, like the nurses. We have a clerk and we have a paralegal. They used to support us with the psychosocial support. They have even supported us during the war, the gender week. There's a lot of violence in this Mombasa. The courts need evidence-based. We need to have proper material collected, and from the training, our staffs are trained on how to collect the specimens, how to package and take to the lab, and with the results, they are able to prosecute.
Since its inception in 2000, the HIV program at ICRH Kenya has successfully provided HIV services to over 15,000 key populations. Over the course of 14 years, the program has achieved remarkable milestones, boasting a 98% testing rate among the key population. Of those who tested positive, an impressive 99% are receiving antiretroviral treatment, with 99% of those on treatment achieving viral suppression. These outcomes surpass the global target of 95-95-95, reflecting the program's dedication to excellence and impact.
I joined ICRH in 2008, and how I joined it, I can say it's a mystery.
ICRH Kenya has established 6 DICs in the following locations: Mvita, Mtwapa, Kisauni, Likoni, Kilifi, and Malindi. These drop-in centers act as safe spaces for key populations in accessing HIV and reproductive health services.
And one day the opportunity came, we were taken for a training, and that is how I became an ICRHK educator. A year later, I was trained as a paralegal.
I've been with the ICRH from 2012.
I've been in ICRH for 5 years. I've been seeking services at Kisauni Drop-in Center.
ICRH has helped me know how to protect myself.
As individual, I've been getting social cycle support in terms of mental health and also HTA service.
ICRH has a very unique kind of staff because they are very friendly, and when you're there, you are in a safe space because you do not feel judged.
And they really treat you with no stigma and discrimination.
And you just feel at home.
For 10 years, ICRH Kenya implemented the Performance Monitoring for Action Kenya project to collect timely and accurate data on family planning. The findings emanating from the high-quality data informed decision-making by policymakers and program managers in Kenya. Efforts that led to it being declared as citizen-generated data by the Kenya National Bureau of Statistics. More details are available on www.pmadata.org/countries/Kenya.
ICRH continues to stand strong, not just guided by our vision, but embodied by it. Our dedicated staff, who are the heart and soul of this organization, are fueled by the transformative journeys of those we empower.
Nilikuwa sisikilizi mzazi, kivyangu mimi nilikuwa naona nafanya kitu sahihi.
Nilikuja nikashauriwa niende counseling hapo na watu wa ICRH. Nikaenda nikasoma hizo wiki 6 nikamaliza. Sasa hapo nikajua venye ninaweza kana mzazi wangu. Hata kama mzazi wangu anakuanga juu, nikimwongelesha na ile sauti yake juu, mimi nakuwa chini. Ndio hapo kitambo alikuwa kikuja juu, pia mimi nakuja juu. Sasa kwa nyumba pakaliki.
In addition to its core focus on reproductive health, gender-based violence response, and child protection and HIV thematic areas, ICRH Kenya has expanded its efforts and also focused on family planning, maternal health, adolescent and youth health, and third-party monitoring and evaluation.
Over the last 20 years, close to now 24 years, we've been able to remain true to our vision. We now seek to continue to push our boundaries by venturing into new frontiers. For instance, we are seeking to shape healthcare services at primary healthcare facilities by exploring provision of point-of-care diagnostics for STI management, which will be a shift from syndromic management of STIs.
ICRH Kenya thrives in collaboration, fostering impactful partnerships to advance its mission. Through dynamic alliances, ICRH Kenya amplifies its reach and effectiveness in delivering innovative reproductive health solutions and evidence-based interventions. These partnerships strengthen the organization's ability to influence policy, enact positive change, and contribute to the overall improvement of health outcomes in Kenya.
We want to leverage our expertise in evidence generation by empowering and through a meaningful engagement with youth-led organization, community-based organization, and other CSOs to be able to use evidence as a form of social accountability to advance SRH rights within Kenya and beyond.